اليوم راح نبلش بالمحاضرة الثانية لسيلبس الجراحة اللي هي الستارز and how to obtain a fine star. صوت واضح؟ صوت واضح لو أعلي أكثر. الفكرة الرئيسية من المحاضرة أنه نناقش اليوم يعني كثير من عندنا راح نواجه يعني إن شاء الله نستخدم مكتوب وأطباء من الأشخاص اللي يتخصصون بالمجال الجراحي من عندهم راح يحتاجون يتعاملون مع السن وكيفية how to solve this thing, how to deal with the stars and how to manage that. هذا الموضوع.
عفوا دكتور.
صوت واضح؟
دكتور الصوت ما هو واضح.
هم واضح؟ هسه واضح؟
مو واضح.
بعده مو واضح. الأطباء القبلي هم هيك مو واضح. ها؟
بالمحاضرة الثانية وعالجوه يعني بسرعة.
يقولوا مو واضح الصوت. نفس الكلام.
الصوت مو واضح. طلابنا الصوت واضح لو لا؟ طلاب سمعوني؟
طلاب جاوبونا على السؤال.
الصوت واضح لو لا؟
لازم أصريح يعني؟ هسه الصوت
دكتور.
واضح؟
العفو دكتور.
تعالوا الصوت كله؟
لا
يلا
العفو.
نعلي إن شاء الله إن شاء الله تدلنا. أوكي نكمل الآن. الموضوع الستارز وهاو تو ديل وذ ستارز من المواضيع المهمة لأنه راح تواجهونها بالمستقبل. أنتم كمقيمين دوريين راح تتعامل ويا الوونز، تتعامل ويا السكن سارز وتحتاجون تخيطون جروح. لازم تعرفون شلون نتعامل مع الستارز وشلون نمنع أن تصير عندنا ستارز ugly bad stars لمرضانا. اوكي. cutting through the full thickness of the dermis will produce a scar. هاي نقطة رئيسية ومهمة. Whenever the skin have been cut in the full thickness, that will produce a scar inevitably. And this is something that we cannot change. If we open the skin, there will be a scar. So we should be cautious on this point. Whenever the scar develops, it will never disappear. أكو فكرة عندنا خاطئة للمجتمع أنه بالتجميل وبالإمكانيات المطروحة اليوم إحنا نقدر نمسح الجرح. أكو مساحة تمسح الجرح. مع الأسف هاي المساحة لن تخترع لحد الآن. Whenever scar develops, it will never disappear. Okay? النقطة الرئيسية مهمة. هذا social understanding, wrong social understanding scientific fact. السوسايتي عندنا كثير من عندكم اكيد عنده مخيل كانه حتى لو يسوي عمليه، حتى لو يسوي جرح، حتى لو يسوي اي شيء، اكو مساحه تجي ممكن تمسح هذا الجرح ويختفي وما يبين بعد. هذا الحكي مو صحيح. Whenever scar develops, it will never disappear. Tell your patient there is no eraser can erase a scar. This is important thing. So, what plastic surgeons can do to scars? How we can manipulate them? How we can make them more acceptable to our patients? This lecture will speak about these things. we need to know some factors. The job of a plastic surgeon in this topic is we are trying to have a relatively inconspicuous fine line scar. This is our goal, this is our job, and this is the art of plastic surgery. So we are not erasing a scar, we are not removing a scar totally, we are making it more acceptable to our patient. And this is the art of plastic surgery. What are the factors that can affect the scars? Whenever scar it will develop, it will not develop in a uniform manner in all individuals. It is variable according to many factors. Some of them are individual factors, some of them are wound factors, some of them related to systemic conditions, and some of them related to our surgical work. Individual factors, we speak about this condition in the previous lecture of wound healing, when we speak about abnormal wound healing like keloid and hypertrophic scarring that can develop in families, and sometimes it is a hereditary problem facing our patients. We should define those patients by having this hereditary problem by asking history, by examining the body for previous scars to see how the body responds to scars. So there is some individuals respond very badly to scars, like those pictures in front of you, which are kinds of hypertrophic and keloid scarring, which is abnormal wound scarring, and we speak about that in the previous lecture. And we told you that there is a stop signal from the macrophages that should stop the wound healing process in the proliferative phase. And this signal, if it is not working very well, that will lead to development of inflation and increase in size of the scars, forming keloid and hypertrophic scars. As you see in the picture, they are inflated, they are extending to the margins of the wound, causing problems to the face. Another example of keloid scar on the nape of the neck of this patient. Skin type. These are also individual problems. Pigmentation or white skin is important in the final appearance of our scars. Pigmented people tend to have more pigmented scars, hyperpigmentation in their scars, and that will lead to make the scars more obvious. As you see in these two examples, there is a scar in the face, but the problem of the scar, it is darker than the normal skin. And this hyperpigmented scar is obvious, and it's ugly, and it's unacceptable. So pigmented people will have bad scars. On the other hand, pale skin, white skin, dry skin will have better scars. Why? Because they are inconspicuous. There is no pigmentation in the scars, and you can see that this lady, we have removed a big bunch of tissue from her cheek because of a tumor, skin tumor, and we did a big lab here and a lot of scars, and the final result is very, very acceptable. It is barely visible scar because the color of the scar is normal and the same of the patient's color. So, other factors are the age of the patient, children, and elderly. In our society, there is a wrong belief that children will have better scars. Why better scars? Because they are growing fast and they are young age, so they are going to have a better scars, and the scar will disappear when they grow up. This is a wrong idea in our society. Some of you may have this same thinking. On the contrary, young individuals, children, when they develop scarring, because of the rapid growth and a lot of stretching on the scar because of the growth, it will be stretched and red and widened. So the scars in children will not be better, they will be worse. In elderly patients, scars is better. Why? Because the skin is thinner and there is a lot of imperfections in the skin. There is a lot of wrinkles, there is a lot of pigmentary changes in the skin. It's not a uniform skin like in young individuals. So easily to hide the scar in those faces. And you can see this elderly patient have a scar in the face, and I think most of you cannot find it. If you search for it, it's difficult to find it. It is here, and this location. Okay? So the children will have a wider scar because of the growth, and the elderly will have a better scars because it's easy to hide scars in the face of those individuals. Regarding the anatomic area, there is areas in the body that hide scar very well, and we can do whatever we wish without leaving problem to the face. One of the best examples is blepharoplasty and upper eyelid surgery, in which we can hide the scar in the pre-tarsal crease in the crease that found in the upper eye. And it's difficult to locate the scar here because the eye is open and the scar will be hidden underneath the fold. So it is a very good place to hide scarring. Other areas are the genitalia also. It's a very good place to hide scars because the skin there usually have very nice scar formation. Other areas have a bad scar history, and usually they develop keloid and hypertrophic scarring a lot more than other areas. The example of that is the sternum, the shoulder, and the earlobe. Okay, they are very bad areas to put scars in them. We should avoid them. We should inform our patients that when we do surgery in these places, the scar will be obvious and will be maybe problematic. Maybe having keloid or hypertrophic scar in these areas. The sternum, the shoulder, and the earlobe. Regarding an anatomical area also, hair-bearing areas is important that they develop scars. Like in the beard of this young man, there is a very obvious scar, and the cause of the scar to be obvious here is the damage to the hair follicle. When we look here, we can find a line that has no hair in it. If there is a hair in this line, it will be not okay. نعم
دكتور الصوت مو واضح ويقطع.
بعد يقطع بسبب النت. أكيد صوت النت يشوفك ضعيف. احنا قبل لا نبلش 3 مرات انقطع النت يوم نكمل. دخلنا 10 دقائق يلا دخلنا للمحاضرة. النت بهالوقت ضعيف فيقطع ممكن صح. بس أنت اللي يصيح بالقاعة. هذا شلون أقدر أحصله. أوكي. حاول تركز. بالنسبة للhair bearing areas, the problem is if we destroy hair follicles during our surgery. During surgery, if we destroy the hair follicles, there will be non-hair development in the scar, and that will make the scar obvious. So we should preserve the hair follicles while we are opening the skin in order to have a less conspicuous scar in the hair bearing area. Direction of the scar. Direction is important, and it is the main thing that we play with at the plastic surgery. We have a lot of consultations from other surgeons about scars in the face if they want to do surgeries in the face. They ask us what is the preferable direction of the scar. And this comes from this image. Our knowledge comes from this image. This image shows the lines of what we call them the relaxed skin tension lines. These lines are the lines that we can put scars in them and make them less conspicuous. They are the line goes with the direction of the collagen fibers in the skin, and they help us in order to put scars in the face and make them less conspicuous. If we cross these lines, if we put the scar parallel to these lines, there will be no problem in our scar. If the scar have been put vertically to these lines, it will be very conspicuous, very ugly, and very unacceptable. And this is important. As an example of that, the direction, we have this middle-aged female with a sebaceous cyst in the middle of the cheek, which is a challenging problem because to remove the cyst, you need to excise it and to do a scar, a long scar inside the face. And this is in the mid of the cheek, so it's difficult to hide it. So we need to follow the relaxed skin tension lines, and in this situation, the direction will be oblique, parallel to the nasolabial fold, which is oblique, and parallel to the nasolabial fold, and this is the correct location and the because there is the forehead have the relaxed skin tension lines in a transverse way, and the wrinkles that develop during age is in this direction also. So scars in this direction will be better held, betterly appearing and defined line, and it will be more acceptable. If we see this lady with a very big loss of soft tissue hair, and the closure was done causing an elevation of the eyebrow upward to close the defect, because there was a loss of skin from the forehead, and the closure leads to an elevation of the eyebrow. But the scar that we are looking to is less conspicuous and more acceptable. In comparison, this young man have a vertically located scars, and they are very ugly, very unacceptable, and very obvious. And that is the difference between locating a scar in the good direction or putting the scar in a bad direction. The vertical line here in the forehead is the bad direction, causing very obvious scars. On the other side, the transverse scar in this lady, even it have a big problem of soft tissue loss and elevation of the eyebrow, the scar is acceptable and good by itself. This is another example of hiding a scar in the crease. This is a dermoid cyst and have been removed, leaving the scar in the pretarsal crease. As we said, it's a very good place to put a scar to be here. Other thing regarding direction of scars is the junction of the aesthetic units. What is the aesthetic units of the face? We divide the face into aesthetic parts. The forehead is an aesthetic part. Each orbit is an aesthetic part. The nose is an aesthetic unit. The cheeks are aesthetic units. The upper lip is an aesthetic unit. The lower lip and the chin is another aesthetic unit. So these are the units of the face. The junction between these units are very good places to hide scars. The example of that is these two pictures. This middle-aged male was having a VCC in the left nasolabial fold. And after resection and closure, we can see that the scar is very well hidden in the nasolabial fold and causing a very acceptable final scar. On the contrary, this young child with a scar in the center of an aesthetic unit, which is nose. This is in the center of the nose. It is very obvious, very unacceptable, and very ugly scar. So, the junction of the aesthetic unit is a good place. The center of the aesthetic unit is a bad place. The shape of wounds also affects us. If we have a rounded wound, a crescentic wound, this crescentic wound will cause problems to us. This curvilinear scar will cause what is called a trapdoor deformity and a trapdoor wound. Why is that? That comes from the explanation of that comes from the previous lecture. What we said regarding the remodeling phase. What's going to happen in the remodeling phase? Can anyone answer this question? What happens in the remodeling phase that can produce this deformity? What we said is going to be in the remodeling phase. There is two important things. Anyone can answer me? Nice, very nice. قد يصير contraction of the wound؟ قد البرسنتج تقريبا؟ قد البرسنتج of contraction من اللينث راح يقل؟ قد راح يقل اللينث مال الwound؟ قلنا تقريبا بحدود 10%. هاي ال 10% راح تسوي لنا shorter scar. هاي shorter scar is going to push the center of the tissue beside the wound up, causing this elevation. As you see in the picture, this is an elevation, and this is a depressed area. And this comes from the wound contraction. يعني احنا نشبهها مثل الكيسة بالخراطة. من الجرة وتقفل الكيس راح يتدور. هو كان فلات وممدود. من الجرة والقصرة راح يصير مدور. فهذا نفس الشيء. السكار كانت ممدودة وطبيعية. من قصرت لمت الأنسجة سوت عندنا elevation بالسنتر. هذا اللي يسوي لنا high deformity. And this is based on the physiology of wound. So we should avoid curvilinear. We should not do curvilinear scars in the center of the face. Okay. Regarding systemic factors, there is vascular diseases can cause wound healing problems. As we said, congenital disorders, Ehlers-Danlos syndrome, other congenital collagen deformity, and nutritional status is going to affect our wound. Finally, the surgical technique. Important thing in this lecture is to understand the surgical technique of wound closure. This is the main thing that we can play with in order to have a fine scar. Okay? The first thing is, as we said in the previous lecture, that the tensile strength of the wound is going to be low at the time of its removal. We said that in the previous lecture. We said that at 3 weeks, there will be only 20% of the tensile strength. At 3 weeks' time, only 20% of tensile strength will be present in the wound. So it will be very weak wound. And this weak wound, with stresses, with shear forces, with everything, it can open first, or even it doesn't open, it's going to be wider. It's going to be stretched and going to be wider with time because of the weakness of the wound at this duration. So it can be suppressed by the forces applied on the skin during this period. How we protect our wound from that problem is by the technique of closure. We should put something to hold the skin, something to hold the skin in place in a very good approximation for long duration, for 3 to 4 months. And that can be done by putting a deep dermal stitches. Okay? Deep dermal stitches, which is stitches that are going to be hidden inside the skin, and that's going to hold the skin for months in order to pass through the remodeling phase up and up, increasing the tensile strength into a good, a protective level, in which the scar will be very fine, very good, and good appearance. Somebody may ask me, okay, let us leave the stitches on the skin for 3 months. What's the problem with that? The problem with that, if we leave the external stitches for a long time on the skin, there will be stitch marks, which is the ugly scars that develop from the stitches themselves, not the scar itself. And they are crossing the scar, and they are, as a railway, ugly, unacceptable, and very nasty and difficult to be managed. So we cannot leave the stitches on the skin for a long time, external stitches. But we can leave internal stitches for a long time because they will not produce any external scarring. And this is how we deal with our skin closure in plastic surgery. We put deep stitches in the dermis, not in the subcutaneous tissue. We should, because the subcutaneous tissue is a weak tissue, cannot hold for a long duration. We cannot rely on that. We should rely on a hard and tough tissue. The dermis is a very good anchor for our tissue. So we can put deep dermal stitches in the dermis with the nose inverted inside the wound, and these stitches are absorbable, synthetic absorbable for long duration. They will dissolve after 4 to 3 months. That is a good duration in which the tensile strength of the wound is going to increase into a good level, acceptable level, to hold our wound in place, producing a fine scar for us. Okay, so the surgical technique depends on this fact. Deep dermal stitches, very good holding for long duration, and simple external stitches that going to be removed as usual. Technique. Other thing in the surgical technique is the tension. If we increase tension, that means the scar is going to be under shearing forces and under stress all the duration of healing, and that will produce a wider and a uglier scar. It's going to be a more visible scar. While normal tension or no tension, it will have a less visible scar. Surgical technique, wound aid exertion. This is another point, depends on the pathophysiology of wound healing. If we think that the myofibroblast is going to reduce the length of the wound, it's going also to try to reduce the dimension, other dimensions. So it's going to produce a depression in the height of the wound. So it's going to give us a depressed scar. How we deal with that? How we avoid to develop a depressed scar? Depressed scar is ugly scar because it's going to have a shadows, as you see in the lower lip of this young lady, having a depressed scar in the lower lip, and there is a shadow. And that shadow will make the scar obvious. To avoid that, we need to have, during the closure, we need to do exertion of the edge. If the edges are exerted upward like a mountain, So during the healing process and remodeling phase, the myofibroblasts will fall and fall and fall and pull the edges down. In the end, it will have a flat scar. And that is the endpoint that we require and that we need, and this is our goal, to have a flat scar in the end of wound healing. So we should start innervation in order to end with a flat scar. If we have a flat scar from the start, sure we're going to have a depressed scar. Okay? Important point. Using a fine instruments and using a delicate technique in order not to damage the skin, not to damage the tissue, in order to have a fine scar, less conspicuous scars, and beautiful scars. This depends on your attitude with the tissue and how you deal with it. Avoiding infection. Infection will cause problems in the wound and will cause maybe hypertrophic scarring or sometimes keloid scarring. The time of stitch removal, as we said, if we leave the stitches for long duration, they will produce their own scars because it is also a wound in the skin. The stitch is a wound in the skin, and it will leave a scar if we leave it for a very long duration. If we remove them in a good time, we can avoid that stitch marks. So in the face, we need to remove the external stitches for 3 to 5 days. And you can imagine at 3 to 5 days, during our experience with the tensile strength, it will be very, very weak wound. So we need to have deep dermal stitches to hold that wound for the rest of the time. Otherwise, we can face a breakage or opening or a widening of our wound. In the body, 7 days will be sufficient for external stitches, not for deep dermal stitches. Deep dermal stitches should stay for longer. And joints will take more than 1 week because it is under very high stresses. Management of scars, how we manage scars after we close wounds and we remove the stitches. So we are going to have scars, and they will need management in order to make them less conspicuous. The first thing that we do is medical management by using silicone. Silicone is a very important material in the management of scars. Silicone gel and silicone sheets is a topical agents that we apply them on the scar, and they have a very good effect on the remodeling phase and improving the appearance of our scars. Steroids is also important, especially if we have hypertrophic or keloid scarring. They will reduce the process of scar formation and will help us to improve the appearance of our scars and reduce the symptoms also, like itching and the pain. Pressure is also important. We should apply pressure on our scars by special garments, special type clothes. Laser, CO2 resurfacing laser, fractional laser is important in management of scars, and the surgical technique. Sometimes we need to revise our scars. We need to redo them in order to have a better appearance if there is problem in these scars. We can do simple excision and closure, or sometimes we need to change the direction of the scar if they are in not a correct way or not the correct direction, in a wrong direction, producing ugly appearance. We need to change the direction of the scar by doing Z-plasty or ZB-plasty. This is an example of abnormal bad scar, T-shaped scar on the face, and we did a resection, elliptical resection of the scar, and this is the appearance, which is very acceptable, nice, parallel to the nasolabial fold, as we said in this lecture. The direction should be correct, and this direction is parallel to the nasolabial fold, and it is the third direction, making the scar more acceptable than the previous acute scar. Please remember the first thing that we speak about in the beginning of this lecture, there is no eraser can erase a scar. Any questions regarding this lecture? أحد عنده استفسار؟ أكون نقطة واضحة؟ شكرا جزيلا.
نعم. أكو محاضرة باب.